And we're live.
Hello, everyone. Good afternoon, good morning, good evening. I'm pleased to welcome you to the MyData versus COVID-19 second call. We started this initiative, we at MyData Global started this initiative last week. Understanding and noticing that there is so much going on when it comes to developing initiatives, data-based initiatives. And we would like to promote those initiatives that are MyData-based, meaning that they are human-centric, citizen-driven. I will tell you a bit more what MyData means, but let me first introduce you to this call. As this is the second call of the series, we will first hear the short update from the initiatives presented last week about the governance framework and three apps. And we will also get the presentation from the new initiatives. And there are 5 of them, so this means that the call is packed. We hope that, of course, we will be able to take questions and answers. And of course, please post also your comments and questions in the chat window for all of us to be able to address them or for the presenters to pick them up during or after their presentation. I'm Karolina Mackiewicz from MyData Global, and I'm very happy to be joined here on this call by my great team, Vivi, Temu, Sila, and Ansku. And maybe just as the greeting to all of you, I would like to give an opportunity to all of us from the team to tell you shortly how we can help you and help the community. What's our role in this MyData versus COVID-19? What's our role? What do we do? So I'm here to organize the calls, to host the calls, and I'm your focal point for the all COVID-19 related issues when it comes to MyData Global. What about Vivi Lahtenoja?
Thank you, and very good pronunciation of my name. Usually people don't do it as well. So hi everyone, Vivi Lahtenoja. I'm the Deputy General Manager for MyData Global, and my background is in academic philosophy and in ethics in particular. So I'm here to contribute to support any initiatives dealing with the kind of heavy philosophical thinking behind all the things that we need to do to get out of the situation as best we can and leave a good world afterwards as well. So that's from me.
Thank you, Vivi. What about Temu Roponen, our general manager?
Hi, this is Temu here. Many of you know me. I'm the general manager of MyData Global, leading the team with COVID-19 fundraising and partnerships, meaning trying to get people into the community and making sure that our community is heard in the outside, and maybe we and some of us get some funding, but what's important is we have energy and impact. Thank you.
Thank you. And I know we have Sila with us, Sila Seb, joining us from our office, home office in Tallinn.
Thank you, Karolina. Hi, everybody. So my name is Sille. I work as a community lead in MyData Global, being the liaison for all of the local hubs since basically 2017. We have 25 of them all around the world right now. And besides that, of course, also helping to connect different people, different organizations, different networks in the MyData community, as well as others who are not yet in the MyData community, but should be. So welcome, and hope to be in touch.
Thank you. And unless something has changed, Ansku Tuomainen is not with us today. Ansco is responsible for communication. She's the communication lead at MyData Global and responsible for putting together our message out to the world and for example, for the newsletter. So we are very happy to, but of course, this initiative, MyData versus COVID-19, this is not the initiative of us. We are the messenger, we are the platform for the community from all over the world to get together, connect, exchange the information, exchange the view, and help each other. And this is what those calls are about. They are this forum. We cannot meet physically, but we are meeting together to put our efforts and unite in this. Well, some politicians say it's a war, so at least a fight and community work. And well, I presented this last week, and of course this quotation or this, well, it wasn't formal recognition from the Yuval Noah Harari in Financial Times, when he said that actually, of course, there is currently this fight between surveillance and privacy, and we think that, or we are under the impression that we can either have the privacy or health, but on the contrary, he's on the opinion that this comes together, and in fact, the citizens should be empowered by their data and by the control over their data. And this is what actually MyData is about, and this is why we actually are doing this. We would like to empower citizens, bring more trust in order to also generate better data for better database solution to fight COVID-19. You're with us, and you will hear great stories and today, and hopefully you will also get inspired. Help us spread the vibe on the social media. We are in LinkedIn, Twitter, and Facebook. You can use the hashtags presented. And just shortly, so I said that this MyData is the community of the people from all over the world. And on this slide, you have actually, like, you can see the dimension. We are not yet in every country where COVID is, but we hope that, of course, not formally, but we hope that with our actions, we are able to actually mobilize the global efforts and also bring the global change. And only shortly for the newcomers, for the people who have found us through social media or were recommended by the friends of friends, what does it mean actually? What is MyData? What MyData principles mean? We are the organization, we are the movement, and MyData is also a set of principles and the philosophy. And we stand for fair, sustainable, and prosperous digital society, where people get value from their data and from the control over their data, and while also the organizations are encouraged for the ethical use of data, and they see the ethical use of data as the most attractive one. And we advocate for the 3 shifts, from formal to actionable rights, from protection to the empowerment, and from closed to open ecosystems. And all this you can read in our declaration on our website, mydata.org. But now you can actually ask, like, okay, so why MyData is actually better than other approach to fight COVID-19? Well, I don't think we can say we are better. Surely, MyData is better. Surely MyData is better than surveillance. All the ethical solutions are better and those that protect the privacy. When it comes to MyData, of course, we talk a lot about the trust. We believe that people who have control over their data and they actually can know where the data is being used, how it is being used, and that is being used, in fact, to benefit them. They are very happy then to share their data, and all authorities, everyone now around the world actually needs this data. And we know that actually the biggest problem of today's fight against COVID is actually lack of data, and we need more of it, and we need better quality, and we need all the people to actually be able and be in the position to share the data. So yeah, we believe that in this way, MyData is a way to go. And of course, a lot is happening. And just shortly about how we are putting those different things together. For example, we opened a Trello board where we started collecting the different apps. You can see here actually that those apps are scored and will, not all of them, but they will be scored according to their human centricity. So for example, the green one are those that are human centric. You can visit the board. You can also add your initiative or the initiative you know about to the board. And when I say we, of course, I don't mean the 5 people you saw on the screen, but actually the whole community. And again, today on the call, we have many representatives of different initiatives. And we will start first with the short update from those initiatives that presented last week to tell us what has happened, what has improved, and still what are still the needs. And first, so we are a bit like the Eurovision is cancelled this year, but we are traveling all over the world. And we will start in the Eurovision fashion, and we will start first from Belgium, where Isabelle, the Zegher, is joining us to tell about the COVID-19 MyData governance framework work. And this is the work that has been presented last week as the MyData COVID-19 MyData Commons. Isabelle, are you with us, and are you ready?
Yes,
to
I'm
share
there.
your screen?
And can I share my screen?
Yes, please. Please.
Okay.
Now you have
First, I'm
the
going
right to
tell
share
you,
your screen.
I'm terrible. I'm singing, so I don't even want to start to compete with anything to do with Eurovision. So can you see my screen?
Not yet.
Okay, I need to do something different then.
You have to do start
yes,
sharing.
Yes, I think I see what I need to do. Desktop and then share. You should see it now.
Yes, we see your screen, and
Okay.
just for the time, you will have some 5 minutes.
Yes.
Thank you.
I'll do my best. So as Karina was saying, this is mostly about governance, but fundamentally what happened is that, well, and as Karina mentioned, there's been a huge amount of work done around governance, about apps, about data commons, about many different things. And it was a great opportunity for a lot of people to share and put ideas together. But, and I think, Temu, you put that as well a while back, it would be nice to actually get a bit more coordination across everything so that we can leverage all the work and make sure it's really something is happening outside of all the great communication that is happening right now. So we had a meeting at the beginning of the week with Paul Olivier, with Carolina, with Vivi, and with a few others as well, to describe about now how can we coordinate different components. Obviously, it starts with governance, which was the starting point, but as everything is kind of linked together, you don't govern for the pleasure of governing, you need to govern something. And so the action plan here, you can see it's very wide than governance. So the idea was to connect several actions with putting some priority. The first one would be to coordinate different documents that have been delivered by Paul Olivier and all the team around that around governance, and that's the first action, and I'll go too quickly into that. Then it's also to work on the coordinated communication. If we don't communicate outside widely, well, it's going to remain great work, but nobody will know about it. There was also a discussion about the need for in-data commons for data standards. That's something that we would need to identify the one that are the most important and relevant for the type of analytics we want to do. And then also obviously everything about application. Priority 2 would be about identifying what would be the best organization or the best functioning for a private entity to do crowdsourcing about governance, and then to move forwards on data commons. So those are really the priority we put together into this action plan. And the purpose of today is really asking you guys that are working already on many of those different initiatives to actually join the different people already involved, or to put your name in the document which is here. And I hope, Carolina, you will be able to share the link of the action plan afterwards so that people can actually put their name and start to, some have already been taking a driving role into this, but so that we have clearly well-identified people. So in terms of the document, for mostly related to governance, the idea is to have an exec summary for authorities and press and public, and then to actually have a much more extensive concept white paper with the governance. And you see the link here. I'll be coordinating that further with Olivier, but we need much more people to support and comment on that. Something like Christian Odlo is also very much involved in that, but please, we need people to look at that and to comment so that we can finalize it as soon as possible, because that is going to help us to actually go into more detail. This is a concept paper. To transform that into something that people can follow, it's important to have guidelines of what we have, of Christian and Olivier have called checklists. So there is work to be done, and there's already something there about different checklists for different apps, tracing app, status checking app, and data gathering platform. And we also need to go into more detail about data commons, the standard part and analytics part. And we may find other components we want to further define. Those are checklists that are very important so that we can implement governance, and also we can potentially score application, as you will see in a minute. So please, if you are interested and want to collaborate in those things that exist already for most of them, please put your name, and there's a lot of information in the Google Drive. There are other actions. So we've started to actually put a Google Drive with all the document, and it can easily give you access to that. There's also discussion about create sub-thematic group within the Corona one, and Vivi is coordinating that. What will be needed is to also then at some point in time understand who is that governance body. So that is still open. Communication plan that you will see in a minute is extremely important. And Carolina and Ansku, I think your name is there. Then there's an already existing activity, which is Yannick Kemper on inventory of the app. The idea is to go further than the inventory, is to organize them by topic, but also then to actually score them based on the criteria we're proposing checklists. Some of those one may be completely meeting the MyData criteria, some may not. And I think it's important for the public to start to have an idea of what are the applications on which they can rely.
Yeah. Isabelle, I will need to shortly, well, I don't want to cut you off, but maybe is it then possible to get the link of this to this document to the chat, if you could copy paste it, and maybe you can give people the indication when should they put their names and what will be the next step from the group. Will it be a call towards the end of this week, or what would be the next step?
The idea would be to have potentially 3 different groups that would be led by the different people. Governance, I'm happy to do that. Data Commons, Ian Anderson, maybe would be nice to have a discussion there. Don Kemp would be on app, and communication would be on on you, Caroline. I think it's important we divide and conquer here. It's too much. And I think it's important we start to actually organize things. So I would suggest that each of the person taking a lead of those 3 teams, and Vivi, there may be another one, but I think those are the 4 teams that we really need to actually push in a structured way with one coordinator. And I think they should have their life, but we could actually update at this call.
Okay. Thank you so much. So please share the link with us. And for all of you, please join this collaborative effort. You saw that this is actually pretty big work. And of course, the aim is to popularize, to make sure that then the MyData governance framework is alive, is known, is out there. Thank you so much. Thank you so much, Isabelle, for this presentation. If you have any questions to Isabelle, please post them in the chat at this moment. And Isabelle has just shared the link to the document, and will also coordinate if you need the access to this. We will make sure you get it. So let us know. And now moving quickly to Finland, we have the Otto, who has presented last week the FeverMap. Otto, are you with us? And can you give us a very short update on what's the status of the app right now? What has changed since the last week? If you can say this in 2-3 minutes.
Yes, so I'm going to use 30 seconds to tell what this is about, because not everybody on the call were here last week. Then I'm going to give a quick status update, and then a call for participation, where we would like to have help from others. So FeverMap is a mobile application where you can enter your temperature. So you have your own personal benefit that it helps you track your temperature from day to day, so that you can more easily spot if your average temperature is going up and if you're maybe getting a fever. And from a collective point of view, we collect this data from people and also a couple of other symptoms that are typical for the COVID-19 outbreak. And then we use this data to analyze how many cases of potential COVID-19 there are out there, because we all know that there is not enough testing capacity, and there is also lots of mild cases where people don't seek to be tested or seek for healthcare. So we want to map out how wide this outbreak actually is. And since people are submitting data on a daily basis, then this is also pretty real-time information of how the situation is improving or getting worse. And we hope to serve authorities with this data so that they can see how their different measures and lockdowns, how they are affecting. And also at some point when the lockdowns are going to be dismantled, see if the outbreak is starting again. And we launched this application into production yesterday and have been since collecting now data a little bit. And we have something like 600 users last time I checked. And hopefully that number will go quickly up. And I posted in the chat a couple of issues. So we are not, we're not in the design phase anymore, or not thinking about the ideas anymore. We have already implemented this and we have it in production. And the next thing is to start analyzing this data and get as much out of it as possible. And we have called for participation for people to help with the API and data model design, because we intend to publish this as open data. So people can also download the aggregate statistics to themselves and do their own analysis. Users can download their own track record to themselves. And then we will also naturally ourselves also analyze this data and provide our own analysis and maps and statistics from it. So if you're interested in this idea, I recommend you join our Slack channel, or I am also on the MyData Global Slack. You can ping me there and check out our GitLab and participate in those issues. Thank you.
when we spoke last week, you said that you are also working with the Finnish National Institute for Health and Welfare to on that. Is this then one of the apps that will be used by the authorities to or endorsed by the authorities to use by the population?
We have reached out to lots of authorities, national level and local levels, but they are still on a discussion level. Authorities seem to be very slow moving on this topic. So let's see how that goes. And we are actually also probably going to collaborate with some Swedish authorities as well. And if you have any connections to authorities around Europe or around the world, this application is already translated into 14 languages, and this can apply almost anywhere in the world. We have all the 6 WHO languages covered. So also if you are from some authority or you just want to use this data for decision making, then please also reach out for us.
Okay. Well, so if you haven't used the app yet, we encourage all of us to test it, to see how is it working, and of course to reach out to the authorities to maybe speed up the process of getting those into use if they seem like user-friendly and good solution. Thank you, Otto, for joining us and for all your work under such a time pressure, and we hope that this will help us all to be safer and also drive better policies to curb the COVID. So again, if I invite you all to not only to participate and to maybe you can also put on chat the link to the map. I'm sure perhaps you've done this, and for all of us to use the map. Thank you. And now we are traveling far. We are traveling all the way to Taiwan. And I hope our colleague Sherry Chung is with us to tell us about the latest development on MyLog14 app. It was very busy time for you guys. Can you tell us in also 2-3 minutes what has happened since the last week and what improvements were done, and where are you with your development? If you want to share your screen, or
okay, I'll share my screen.
Yes, so hello, Sherry.
Hi. And so I'm going to share my screen to you. Carolina? Oh, okay.
Yes.
Oh, no, I just cannot press the share screen button. Okay, I can share now.
Yes.
So, so can you see my? Okay.
Yes.
Okay, so in the last week, we joined a hackathon, which was held by the HackSuik, and it's from, I think it's from Friday to Sunday. Friday to Sunday, but actually it's Saturday from Monday in Taiwan time. And so in that hackathon, so we just using 3 days to build our app. And now we have the first version. So maybe some of you had heard me to introduce the project. Some of you haven't heard. But if you would like to understand more, you can go to the dev post page, and you can find the MyLog14. So, and everything we done in the hackathon, you can find on there. And we also get some very great comments from the people in hackathon. And we will still keep going on developing the app. So next, I will briefly introduce the app. So in the hackathon, yes.
Sherry, please note you have very little time.
Okay, I understand. Yes. So in the hackathon, we found that a lot of people doing the tracking app, but we decide to I cannot switch. So but we decided to do another app which focus on people who are doing home quarantine, an app that can let them to capture and record themselves and do and if they would like to share, they can share to others, but all the data is kept privacy. And for the citizen, what they do is only to record their personal data, and the data will be encrypted and published to IPFS. And for the government, if they need to use the data from the citizen, they will receive an URL and a passcode, and the passcode will be expired in 14 days. So the data will keep secret. And now here's the wireframe, but I think maybe you're not interested with that because it's too small, but just let you see that in the hexagon, we designed the file worm. And here's some mock-up of our ape. And you can capture, took a picture. So if you took taxi, you want to record the car plate, and you can took picture. You can measure your body temperature, and you can check if you have symptoms that's similar with COVID-19. And also you can store your location that you can check where you have been visited. And so now here's the system flow, but I'm not going to explain the system flow because I'm not a technical person. So don't ask me a question about that. Just let you see how our structure. And if you want to know more, you can visit the DevPost website, and we have a GitHub link on that. So you can also check our GitHub part repository. And in the backend side, we will verify the key and the passcode to see if you share the data, we will check the passcode to see if the passcode is right, is confirmed. Yes. And also if the person wants to share the data to the government and the CDC, they can have a dashboard to view the data. So this picture is a real one. It's a real backend. So we have very few data because we just have 3 days data on it. And we will also make some little graphic to show that how many people are using this app to fighting together fighting against the COVID-19. Then here's the three main point of what our app is different from others' app. That our data is kept locally and the user has the full control. If you like, you can delete all the data. Yeah. And also the profile is anonymous, so no one will trace to you by the data you shared. So here's the the slogan of our app: just log your own data and keep your own data, and the data is not checked by anyone else or by the government. And here's the last page. So our app is called MyLog. We use the log because we think it's a record, or you can say it's a logger of your personal life, your personal data. And we also want this app can be used not only in the COVID-19 time, also when the disease has passed, the app can also be used for personal purpose to record everything you want to record. Yeah. So together we log. So that it's a slogan of our app. And thank you. So if you have any question, you can ask me, but don't ask me about the technical question.
But maybe, I mean, yeah, you can always guide us or the people who ask to your colleagues who can explain.
Yes.
I saw
you can put the question, the technical question, on the GitHub or on the DevPost page. Yes.
Fair enough. I saw on Twitter that you were you had the competition about the logo. Now I see that I think the logo is chosen.
Yes, the logo is chosen. I think you vote for that logo, right?
Yeah, I think so. And I think there was also some voting for you in the hackathon. Is this voting still going on, or would you like to ask the community to help you with voting?
The voting is end.
Okay.
And yes, they have choose the top 25 popular team, but we're not in that. I think we might have only 10 likes or something. So for the top one, they have hundreds of likes.
All right. Thank you, Sherry, for sharing this development with us. Well, Sherry is with us on the call, so please feel free to ask her a question. in the chat, and if we will have time to, I hope we will have time later to also connect and ask the questions from the audience, from all of you. But without further ado, I would like to still go to Germany. We would now ask Sascha Gartenbach. Last week he presented the tracking app being developed under the name VIA. It turned out that over the week the app is now called Got It. Today actually the initiative called Gesund Zusammen was launched. And that's the initiative of the broad alliance of the German tech companies to actually advocate for better solutions, ethical solutions, protecting data and saving lives. And we as MyData Global, we are proud also to be the partner under the Datenschutz or privacy partner. And we got the message from Sascha that actually the app is being developed and it should be launched next week. So hopefully then Sascha will be with us and can tell us more about those developments. So as you see, a lot of things is happening. And now in the second part of the call, I would like to invite the initiatives that didn't present themselves yet. And we will again travel around the world. And now we will go to France and US to hear from Bastian. Bastian, are you with us?
Yes, I'm here.
Hi, Bastian, to tell us about the QuantifiedFlu. And yeah, I don't want to rush any of you, but still my role is to, of course, to keep the time. So please go on. Do you want to share your screen?
Yes, that would be great. Let me do that.
Please tell us what the QuantifiedFlu is and where are you with your development and what kind of help you might need from or you would like to ask from the community.
So there we go. Can you see my screen?
Yes.
Great. So the QuantifiedFlu is a project which comes out of the Open Humans Foundation, which is based in the US and with whom I'm working here from Paris. So I think maybe some of you know the executive director, Matt Ball, who's also on the MyData Global board. And they and we started building this idea, I think a couple of weeks ago now. I think around 2 weeks ago, we started working on it, thinking about, can we use all the wearables we are using, like here, the Oura Ring or our Apple Watches or Fitbits, to actually figure out when we are falling sick and get an infection based on the heart rate, the body temperature that's measured, and so on. And decided to make a citizen science project around this. And I think mid last week, we actually launched the first prototype of the QuantifiedFlu, which you can see here on my screen. So, and the idea is that you can do two things. You can report past illnesses if you have been sick in the past and you already had a wearable at the time, and it will generate graphs like this one here. And you can do daily check-ins and report your symptoms, which you then can go back and correlate to the wearable device data later on. And all of this data of people who agree and opt in into this will be shared in a de-identified and aggregated way for researchers and everyone else publicly, so that you can use this data as well. And just to give like a very simple idea of like how it works, let me see whether I can remember when I fell sick. So it might take a while. Yeah, my internet isn't great. So you can just basically look at past events like the ones. You can schedule your check-ins for when you would get reminders to see whether you're sick today or not. And you can just add the sickness event. And I think for me, one was 2019, yeah, like the 29th of September last year. I'm very certain because I even have it in my calendar. And you just press the Analyze this event button, and you can look at the graphs it generates from this. And then you get these visualizations, and you can see indeed my resting heart rate during the night was highly elevated when I was falling sick. My body temperature increased quite a lot compared to the baseline. And we have now around 100 people who have already contributed data to this. So if you go to the public data setting, You can look at the individual graphs people have made, and we also have a JSON endpoint. So if you're a programmer, you can just get the data easily and get them from the API in regular intervals. And so the first call to action we have is, if you have any of the wearables we support so far, which unfortunately are only Fitbits and Oura rings, you can start participating today if you go to QuantifiedFlu.org. And we are currently in the process of getting support for Google Fit. So if you have any Android Wear things, and also for the Apple Watch, these will be the next two ones that hopefully will be ready to launch next week. And if you are capable of doing data visualizations, doing data science and analyze the data, or do web development and could help us improve QuantifiedFlu, then you can go to our GitHub on Open Humans QuantifiedFlu, where there's lots of issues which are already tagged for you to see where there's support needed, whether it's a good first issue, and what kind of development is needed. And I will stop at that, and let's keep going with the call. Thanks. And if you have any questions, please get in touch via the chat.
Yes, thank you so much. Thank you for this presentation and also your initiative. I don't have any question, but maybe there is someone from the audience. We can have one question now to Bastian. I see only on chat, of course, sharing the information about the Oura ring. We know that I know one story actually shared widely here in Finland about the first patient in the city of Turku. That actually he was the, I don't know if this all started from him, probably not, but yeah, he was the one that he said he woke up feeling pretty okay, but he realized that his Oura ring told him like, you are not good.
Yeah, so it goes back to this a bit. So we started the whole thing based on discussions in the Quantified Self forums where the community came together, and it's really a community effort. We have many people contributing on the design and everything based on these initial ideas. So we were wondering whether it's possible, and then we saw this blog post of the first patient that reported seeing this, and we're like, okay, so apparently it's worth for us to invest some time here and build this.
Wonderful. Thank you so much, and thank you for sharing. Again, I invite you all to post the question to the chat. I also informed you that this time we decided to prolong this call by 15 minutes, so have the 75 minutes, not the 60, to also give you a chance to ask questions. So don't leave. I understand that, of course, some of you will have to. But I would like now to thank you, Bastian. I would like to now welcome Alessandro de Carli, joining us from Switzerland. Alessandro, are you with us? Perfect. You already took over the screen. Fantastic. You have. We've heard the news at the beginning of this week about this app, WeTrace. That apparently it builds or it relates to the Singaporean app, but it solved the issues of privacy. And Alessandro, I welcome you here, and please give us you will have 5 minutes to present what are you working on, and if there is any wish for the MyData community to support you on this. So you can go. I don't know if you are, I see your screen, but I don't hear you.
That's why.
Okay, hi.
Now it's better. Hello, everyone. Thank you for hosting this. Thank you for having this session. I think the 5 minutes will be plenty. Yes, like you already said, what is special about this tracing app is that it's really focusing on privacy. And my background is actually in cryptography, working for Swiss financial institutions and banks in the mobile security space. So what we basically did is we use concepts of asymmetric cryptography to create an app that allows you close to perfect privacy. And there are many tracing apps out there. The specialty about this tracing app is that you have a close to perfect privacy from snoopers, from the contacts that you have actually been in contact with, and a total privacy from the authorities. And I will walk you through this. This was created, funnily enough, also during the hackathon at Hack Zurich, and we managed to score the 3rd place. It's an open source project and will also remain that way. I have here a video that actually walks you through the various stages. That's why I think it's the easiest thing. It's a mobile application that uses asymmetric cryptography and decentralized concepts. And what this means is that the data remains on the device locally. And if you want to actually report data to the people you have been in contact with, then you will encrypt this data with the public key of the person that you encountered. So only that specific person will be able to receive that message. And this means that you will only receive a message that says, hey, you've been in contact with someone during the last 14 days that actually had the virus. There is no IDs that you are exchanging. So this is really using just the cryptography. This means that there's no way for you, if you receive the message, to actually find out who that person is that sends you this message. And we will see now a little video showing how the whole system actually works. And we see here a lady that is using the application and is in public transport, and another person that sits right next to her. So this person counts as a close contact. Both people have the same app on them, and it's using Bluetooth LE to detect this close contact. So both application will be, hey, there is a close proximity with one person. And now if one person, even though this is a stranger, then turns sick and reports as COVID positive, he has the ability to choose which kind of data he wants to share. So in this case, he can say, I tested positive and I want to share my location because this might be useful for the other person, or I even want to share the time when the contact happened. But he does not have to do so. So this data does not need to leave his device if he does not want to. And this will generate then a message, and the lady that has been in contact with this young man will receive the push notification telling her, yes, you have been in close contact with a person that has been tested COVID-19 positive. Please watch out or self-quarantine. And because now this person decided to share the location, she will also see the location and time. And that's basically the whole system, how it works. As I said, there are many solutions out there. However, all the solutions work with some sort of IDs and randomized IDs. The problem with IDs is that you can link them and still find out who the person was. With this proposal we have here, which is of course open source, and we have also technical paper explaining it, that problem gets mitigated entirely. And before we go to the questions is, for me, something to highlight that if you're building a trace app, please take a look at the actual protocol, because I really believe that this protocol can help you, and it's all open source, and we don't even want to take any credit for this. So it's really there free to use for you.
Mm-hmm. Thank you so much, Alessandro. Can you tell us if when will the app be launched, or has it been launched already?
Right. So the problem is that we would like to so the application is published on GitHub. Everybody can just download this application and then also compile it and check the code whether it is true what I'm saying. However, we haven't published this to the stores yet because I believe that we would need to perform a little more polishing, because what you see here got produced within 48 hours in the context of this hackathon. And not all parts are where we want them to be. Of course, we have full-time jobs, and it's difficult now during the week to finish this up, but eventually we will find the time to actually finish this up. And I hope that either some government organizations or some foundation will find interest in this so that we can really push for this protocol. Because another thing to highlight is that if every country starts creating their own tracing application, this will not be as useful as if we have one protocol that fits all legislation. And I think this protocol will have to be the most privacy-aware protocol, because if you want to share information with the authorities, you can always do that on top.
Mm-hmm. Thank you so much. And this is impressive what you said about the 48 hours. We've read today on our Slack channel, Corona Data, that actually the Singaporean app has been developed, of course, after the last outbreaks of SARS. And actually it was like at least 1,000, if not 10,000 hours being put there. So please put your contact information in the chat. And I see that there is also the question from Jono, and we will move forward to the next presentation, and perhaps we can still come back, but you can also reply in the chat.
Sure.
Thank you so much. And I would like now to invite Dixon, who is joining us from Tokyo. Tokyo with the blooming cherry trees this year.
Yes.
Also on the lockdown. Can you take over the screen from Alessandro and go on with your couple of minutes?
So can you guys see my screen now?
Yes, we can.
Yeah. So hi, I'm Dixon from Personium project from Tokyo, and I would like to briefly talk about using 5 minutes to go through this, not all the slide, but half of the slide, so you guys can get the slide URL later on and then read it carefully.
Yeah.
And what we want to do is like using PDS to stop the pandemic. So so my favorite picture is like we have to make it happen and make it right. So we want to do it, but without sacrificing your privacy. So it has to be done that way. Otherwise, it's useless. So basically, we allow users to cross-check their location log, and it's personal, and it's against anonymized location logs from the infected people from open data or from many authorities. So and then afterwards, they can determine whether they have exposure risk of COVID or not. And basically, there's three functions. One of them is like they save the log privately inside their own PDS, so no one can read it. And then they can see the risk analysis also privately, only in their own PDS. So all the calculations and routine and programming doesn't leave their PDS programming space. And then and thirdly, it's like if they kind of think that they are infected, they can decide to share their data or not. And also when they share, they can select whether certain items that can be shared, and they can select, and then it will be anonymized, and then it will show on their screen that you're sharing this data, and then it's okay or not. So everything is like privacy by design. So it's kind of protecting the privacy of the users. And the target user would be for people who want to do self-checking when they have to go to work. We know that some people have the luxury to do teleworking, but then a lot of people has to go to work every day, like my wife. So then in that case, they go to different locations and contact with people, and it's for their safety to kind of cross-check whether they are okay or not. And also another target user will be the people who's infected. So if they're infected, sometimes they don't want to go to the hospital, and then because they might get bashing or whatever. So for their safety, maybe they just want to share it anonymously and then help the stopping, because they don't want other people to get contracted further on. So those are the two main targets that we want the PDS user to use. And then this kind of like a screen image that we have. On the left-hand side is the guy, like, for example, me, on March 11, I do something, and then most of the time it's green, but then it pop up with kind of a warning that if I've been to that restaurant, maybe I have some problem. So I click on that warning, and then it will show me that some guy kind of saying that from this time range, he has been there and he's been infected. And this information actually is from the open data. So in that case, I was kind of half an hour in the same restaurant, but I'm not sure if I'm there or not. So maybe I will go to the hospital to check up or not. So it's just advising me if I have to do anything, but it won't tell me exactly if I'm infected or not. So the whole ecosystem is kind of like the user do all the things by himself on the right hand side, and then he save everything into the his own PDS, and no one's gonna able to see it. And then once he thinks that maybe he's infected, then he can decide whether to share the data or not. And the data will be fed into the service provider, and anyone can be the first service provider. So supposedly government should be the better, and then all the data should be anonymized. And if we're lucky, then we can have government data, and then also from hospital of the region. Like if I live in Tokyo, then I have all those open data from Tokyo municipality, then it would be great. And then it will be increasing the analyzations.
Dixon, you have 1 minute.
Yeah, and the actions we want is like, we're not very good at, we have the whole platform already, but we're not good at iOS and Android app, especially location record or whatever. So we need some kind of front-end engineer to help us out. And also for the data, what kind of data we can take, like locations is okay, but should we take the gender, should we take age or whatever? Oops.
Okay.
Yeah, and we also need, for long term, we want UX design. So please help us, and then probably we can do something. So that's all. If you have any questions, just contact me from Slack.
Perfect. Thank you so much, Dixon. So perhaps you can still leave your comments and calls for action in the chat. And of course, for all of you who are joining us, and yeah, everyone can basically from the presenters be reached out through our Slack, so the platform, and everyone is in Corona Data. And those who are not, then welcome, of course. So thank you, Dixon, for this presentation. And now I would like to invite Thomas to joining us from Austria to tell us about the Minerva wallet. Thomas, are you with us?
Yes, I'm here.
Yes, and yes, you also have first time, but hopefully enough to present to your work.
So you can see my screen?
Yes.
Okay, very good. So, okay, thank you very much. And I'm not so much talking about the wallet itself. I'm talking more about a project what we did during the weekends, also at a hackathon here in Austria. And it's about a I'm immune certificate. So it's basically something we are all confined at home together. We are sitting at home. Everybody knows everybody's family in the meantime, and somebody's walking in the back, or babies are crying in the back. And we thought about there is quite a high number of people which are probably have been sick, have been infected, and they would actually be very helpful if they would be able to take over some of the work which is maintained, and over time it should prove quite helpful to have a I'm immune certificate to return to work and also to social life, what we are, I think, at some point really need again. So we developed something, some system, and I want to describe the system to you. So basically, consider you have Alice, and she might be already immune because she had the symptoms, and she wants to get a COVID-19 I'm immune certificate. So to see, to prove to others that basically she is already healthy. So the first thing would be in that process that she's having a digital wallet. I'm going to show you one, but this is kind of building an open standard. So basically it's just one of many possible wallets who could manage that kind of certificate. So she is providing at the test center a test sample and some personal information, because usually they are gathering the personal information to kind of combine the test data, and also for legal reasons they are collecting that information. So they pass on the information to the laboratory. The COVID-19 test is done there, and that particular laboratory is registered on a blockchain system. So basically, signature of that kind of laboratory can be checked. And finally, when the test results is done in the laboratory, she will get her I'm immune certificate, and she will directly get it pushed to the mobile phone. So just to repeat that, it's basically 4 simple steps. You get a digital wallet, you fill in your identity information, you get some ID to get to a test station, but basically it doesn't need to be that way, because some countries have free tests. You can just go there. Other countries are limiting it to people which only show symptoms, and so on. So in the third step, basically you're at the test center and you provide your ID and the sample. And finally, you get the immune certificate pushed to your phone. That's basically it. And what you can do then with that certificate is that you have it in your wallet, and whenever you need to kind of prove that you are already immune, you can show your certificate. It can be scanned, and basically it can be independently verified. And just to give you the kind of idea behind it, so it is thought to help the people which work in healthcare, the people which work in supermarkets, because if, let's say, I'm working at a cashier and I'm already immune, I know that I have already some protection. So myself, I don't have to live in fear to get the infection, as well as I'm not easily a spreader of the virus, where a lot of people are passing.
Thomas, 1 minute or 30 seconds too.
Okay, yeah.
Yeah.
It helps with tourism. It helps, of course, with getting us back to work. The USPs are it's scalable. The data is completely within the wallets. It's globally applicable. It doesn't need a functional government, although it's helpful. And it's secured via a blockchain system. That's our team from the weekend. And because it's the question of how the MyData community can help us, we're especially looking for connections to governments, WHO, Red Cross, all funding sources. We know how to build the software, we know how to make that, but basically somebody needs to want it, then it is going to be enrolled. So here are my contact details, and I can share the presentation if you like.
Perfect. Thank you so much. Yes, actually, I asked you also to send the presentation to me, that I can include this later in the recap and in the master deck for this call. So yeah, it seems that we all are looking, or many of us are looking for, of course, to the contacts to the authorities. So I also maybe my call for action to the whole community hearing the call and watching us on Twitter now, following us. Please help us reaching out to the authorities. I'm sure that also authorities, of course, they are now overwhelmed, but they are also looking for the different solutions to get us all from this very difficult situation. So let's help them find each other. Thank you. And there were some for you, Thomas. There were some questions in the chat, so I will invite you to look into that. While I would like to invite Terho from the MoveSense or MoveSense to tell us about your work shortly. Is Terho with us?
Yes, I'm here.
Hi. Hello.
Hi. Hello, Carolina and everyone. So actually the company is Suunto, which is a Finnish manufacturer of sports watches, like this one here. And we have a project called MoveSense, and it's this kind of a little sensor that can track movement and physiology. And we think that it could be used in different ways to help in this coronavirus battle, and especially in managing patients and identifying symptoms. And I've got a little presentation here that I could share on the screen. Sorry, I take over the screen share.
Down there, there's, yeah. Mm-hmm.
And okay.
So just for the sake of time, there will be some 4 minutes.
Yeah, I try to be quick. So overall, MoveSense is an open platform for building wearable solutions, and it's based on Suunto hardware, and we've got a package of like SDK and accessories for attaching the sensor and generating data that can be used in different ways. The sensor can measure ECG, a single channel ECG with a chest strap or with patch electrodes. It can measure heart rate, beat-to-beat intervals. It has an acceleration sensor and a gyroscope magnetometer for like complete movement tracking. There is also a temperature sensor inside the device, and it's possible to connect also external like medical grade temperature sensors through the contact pins that we have on the back side of the device. And all the data is coming through an open API. You can program the device itself. We've got some sample applications for the device. We've got libraries for Android and iOS for building mobile apps, and different ways to connect the sensor, like said, these chest straps and other options. And now we think that there are ways how this could be used for helping the healthcare personnel and patients who are sick at home to manage their situation. We are not medical experts ourselves, although we are going through a medical certification for the CE part at the moment for the sensor. But we are offering these sensors now free of charge to developers and companies to test and try out and prototype different ways to use this data to help the whole world out of this situation, and to help healthcare personnel to manage patients, especially if they are running out of these larger hospital equipment, and also for people at home or to support general practitioners to evaluate how their people who are sick at home, how they are doing, and when would be the right time to go to more professional care. And So that's quickly the pitch. If you are interested in trying it out, drop us an email or connect through the chat, and I will share a few links on the chat channel. So on mosens.com website, on the news, there is an announcement about this. And then in the developers section, you'll find more information in practice, how to do that. So that's what I wanted to say. And please continue from here.
Yeah, thank you so much, Terho. Well, one immediate question was, what is the cost?
The unit cost, if like for individual pieces, it's around 40 euros, a little bit below. But then in larger quantities, the cost obviously drops to, depends on the quantity, but around 30 maybe. And but now for testing purposes, developing, we take all the cost, and we want to help in this battle.
Thank you. And I understand it's globally or Europe. What's the scope of this help, or is it
anywhere?
Or global? Anywhere. All right.
Anywhere in the world who just has a good idea and a concrete proposal, then we'll supply with sensors.
Thank you so much, Terho, from joining us from some beautiful place, at least behind your back.
Wow, that's a virtual one.
Yes, but thank you for bringing this nature to us and your offer, very generous offer. So yeah, thank you all the presenters for sharing your work, and this definitely should be prized. And now using the Terho, there are still some questions coming to you. So maybe you can
yes,
have a look at the chat. From me, of course, there is tons of information, and all this will be brought to. We will have the recap, and we will bring this all together to you on Slack and on the social media, all this recap. So what if you missed some links or something, that will be brought. But I mean, I know that of course some of us are very busy and have to drop from the call, but still some would like to perhaps ask something either to any of the presenters, or just say have a comment or have a say. So now it's the time for that. Is there anyone here who would like to ask a question or make a comment? Just be brave. You can unmute yourself and ask a question. Okay. I see that there were, of course, lots of interaction on Slack, on chat. And I mean, this is not the end. This is something that we continue doing, and we will have the next week call at the same time in the same space. So please share this information with your colleagues, and invite the initiatives that would like to present. And invite also, of course, the other people who would like to hear about those initiatives. So maybe shortly, as for closing from me, where can you actually find some information? I already mentioned many times MyData Slack, so our communication platform. There is a channel, Corona Data. You can join Slack anytime. You don't need any special invitation, and it's free of charge. And also you can add your idea or the app you know about to this, add an app to MyData COVID-19 app list. Oh, what did I do? And as I mentioned already, we are collecting those apps in our Trello board, MyData Global COVID-19 app list, and we would be happy to, if you help us share share the information on social media. You can also reach out, of course, all information about the declaration papers, what MyData is about, is on our mydata.org website. And you can also join our organization either as an individual member or the organizational member. And I see that there were no other question or comments. There was exchange on Zoom, on chat.
Carol.
Yes. Yes.
Can I just comment? Can I just comment quickly on the funding?
Yes, please.
Yeah, so I saw at least, I think Thomas was asking about the funding, the call to action. Just got, thanks to Carol, a good resource for some COVID-19 related funding. And there was also a Mozilla funding call just launched today. So the best way to, I mean, we'd like to be informed if you know of any funding opportunities. And of course, we will share on the Slack such opportunities. So please, let's communicate about those as well. And of course, we're interested in any kind of sponsorship interests that may be within the companies who are on this call. But that's just a brief note from me.
Thank you so much. Of course, then, yeah, funding is on everybody's heart. So let's share the information. Maybe not in the context of COVID itself, but still about funding. You might have seen on our social media or in Slack that tomorrow, together with the NGI DEPSI, we will have the webinar, the info webinar about the funding available to the data portability innovators. Perhaps there is someone here in our meeting from that works with the data portability and is interested. NGI DAPSI funding open until 24th of April, and tomorrow at 3:30 set there will be a webinar on that. So perhaps with that, I will ask Esko to finish our lovely stream on Twitter, and I would like to ask all of you to engage, to come to Slack, to discuss with us, to share the initiatives with us, to spread the word on social media. And you can ask, of course, why all the time sharing. I mean, it's great that we know about it, but it will be fantastic if also the decision makers and also the general audience will know that there are some apps that are safe and can be trusted.